to the situation with coronavirus. But I'm going to begin by asking Diputado Miguel Pizarro to bring us up to speed on the political context and the really dizzying developments of the past few days. The indictment of Maduro and other top officials, the announcement of a transition framework by the U.S. Secretary of State, Juan Guaidó's call for a government of national emergency. Miguel, if you could just briefly kind of bring us up to speed, tell us where this leaves us and what it all means, including for coronavirus response.
Thank you, Michael, and thank you to the Dialogue for hosting this event, and also to Feliciano and Daniella to be part of the panelists. It's hard to be brief with a complex explanation, but I will try to do my best. The proposal we made on the weekend, the proposal President Guaidó made about the emergency government and the Council of State, and the same proposal that was framed by the State Department and Secretary Pompeo and Special Envoy Elliot Abrams, is without any doubt a proposal to find a political way out of the situation we are in right now. It's a reframe of the conclusions we had after the end of the Barbados talks, the Norwegian negotiation we had during last year. And it's a broader proposal. It's not only for the political purpose, for the exchange of power or to build a transition. It's a proposal that aim to build a new political scenario, to build real solutions, and also to send a clear message to the members of the regime, but especially to the members of the army and the middle rank officers in executive positions in the regime, to stop supporting Maduro and start building solutions based in a new political scenario. The regime, Michael, as you know well, is closing all the political options in the past that we are tried. We tried 4 different negotiations. We tried following the electoral path and winning the National Assembly, and from that moment on, trying to make a referendum, trying to propose a presidential election, trying to build a different way of transition. But to all these proposals, the regime has always the same answer. No, every time they're neither to find an agreement or to find a final political solution, they step out of the negotiations, and that have a close relation with the links of Maduro and important members of the regime, with corruption, with irregular groups, and with illegal activities. That kind of connections make for them impossible to see an option after the power, but it doesn't have to be the same for all the members of the regime and the army. And I've heard in the past days that sometimes international pressure seems to close the political space or to close the political options. And I want to share a reflection with everyone who's hearing right now, because sometimes we are only, in the public opinion, we are only following what happened with Venezuela through the eyes of the international community and the actions of USA or the European Union. But how start this morning for us? 4 a.m., the Counterintelligence Police Corps made a raid against Demóstenes Quijada, one member of the President Guaidó team, a technician. He's not a member of the National Assembly. He's not a politician. He's not a congressman. He's part of a supporting team to process data and to give reports to the office of the president. That raid was in his house with his kid of 8 years old and in front of his wife, who's pregnancy. It's a couple of weeks ago from giving to birth a new child. What happened in the past 2 weeks? This is the 5th member of the Guaidó's team taken into custody by the counterintelligence police. I am part of the 33 members of the National Assembly who has been sentenced. They killed Captain Acosta. They tortured Fernando Albán. They're trying to take all the humanitarian situation right now as a hostage, because in the calculation of the regime, if they can make all the people being part of a huge experiment of suffering about the humanitarian situation, in some moment, the international community and the rest of the governments and the countries will have to interact with them. And I make this reflection because the political space in Venezuela is being closed for the past time. And what we're trying to do, not only in our proposal of the emergency government, not only in the framework the State Department present, also with the support of Germany, Colombia, Brazil, Austria, Lithuania, is to give a new path for a political solution. First, to answer to the urgent needs of COVID-19. It's impossible to have access to the level of financiation or to the level of money is needed in Venezuela under these circumstances. Second, to build a new political scenario with different actors. And in this, I have to underlay really well what Guaidó says. If to make a transition, that means that both Maduro and President Guaidó have to step out of the state council and to build a new council to rebuild institutions and arrive to an election, we are able to do that. Because for us, our main goal is to save the life of the Venezuelans and to change the situation inside. But we have to have an approach of the broader understanding of the situation right now. The regime is trying to use humanitarian emergency and economical breakdown as a hostage of using the population as a human shield to avoid a real change in the country. And we're trying to build a transition for it. And about the indictments and about the decisions of the Department of Justice, we are making the announcements for a long time ago. And I think in some moment they will have to answer in front of a trial in a court, in a fair trial, in a different trial than the one they make against the members of the opposition. For us, it's a clear strategy of all the pressure possible to build a real negotiations, to achieve a transition, to have a political change in Venezuela after a fair and free election. Thank you, Mike.
Thank you, Miguel. Thank you. That was obviously very compelling, and I appreciate you covering a lot of ground in the short time we gave you. So I think we'll come back to a lot of the themes you mentioned. Feliciano, Reyna, let me turn to you. I think the context, the very challenging political context that Miguel describes, explains why some people are referring to the COVID-19 crisis as an emergency within an emergency. Obviously, we know Venezuela is already suffering from a humanitarian crisis, but this new threat really presents a fresh and urgent set of challenges for the country. So can you just talk us through what we know about the state of the COVID-19 pandemic in Venezuela, how it's likely to evolve, and maybe more importantly, how you assess going forward the capacity of the country to respond to the pandemic?
Am I on? Yes. Thank you very much, Michael, and for the dialogue to facilitate this space. Muchísimas gracias, and for all who have joined. Even if one wants to talk about COVID-19, it's impossible not to think about what has happened in the past at least 4 years, but coming from many more years of effects of the abuses of power, of grand corruption, of the erosion of the rule of law, and violations of human rights that brought us to a state of real precariousness, let's say, in terms of protecting the Venezuelan people, as we all know, with lack of access to food and health services, education, and the near collapse of public services such as access to water and electricity and so on. I think this is important because, again, as Mark Lowcock, when they presented recently their global response plan, said that among the countries that needed a special look at regarding the situation with COVID-19 was Venezuela. So it's like as if we had been hit by a first tsunami wave from which we have not recovered yet. And now we have this second wave that is going to probably be hitting us in the coming days and weeks. And we are definitely not prepared for that. As we all know, with the 5 million refugees and migrants, which were supposedly, according to some calculations, helping some 30 to 35% of the population inside Venezuela dependent on remittances, we can think of those 5 million now, a large majority lacking access to those resources, working informally and sort of trying to make a living, but still being able to send some money to Venezuela. So that creates not only a major problem inside, but also for those who are living in many of the countries in the region, plus Spain and other places. But, thinking about the large numbers that IOM and others have mentioned, reaching these 5 million, what it would mean to the region, again, to be able to provide for these almost 5 million people, and again, the majority affected. The informal opening of some transactions in dollars and Colombian pesos had also been helping people here to get, $5 for a tip or $15 for repairing a motorcycle. Now this is all over. So again, it catches us at a really a difficult moment for the vast majorities of the population. And then the World Food Program recent numbers, which again says that 1/3 of the population is food insecure. But one very important issue that they mentioned is that if one looks at coping strategies, 61% is food insecure. So if you take out, the possibilities that they had to reach some, means for making a living or for getting food, then this is going to get much worse. And of course, the GDP drop, some calculate that after 7 years of almost 60% of a drop, this year might bring us, from 19 to 30%. So if one looks at the latest, and this is just from yesterday, the response plan by and the state of the situation by the UN system. It's the intersector plan. What they're saying in all their assessments, again, tells of this very, very difficult situation of destruction of capacities that we're coming from. And speaking with some specialists, let's say, in the situation as well, they're saying that beyond what COVID-19 poses as a health threat, we should look very, very carefully at access to food and distribution, because we're asking individuals, families to stay at home, to respect quarantines. This is not going to be possible. We'll see people coming out anyway to try to make a living, and this is going to be risky for the situation. I will not go into the details that I had taken for this conversation, thinking about time, but I think it is important to look at what the WHO has defined as sort of the 4 scenarios of transmission for COVID-19. They have 4 levels, and Venezuela, for a time, the government was trying to keep us sort of at a 2nd level, like countries with 1 or more cases, but isolated, imported, and detected, on time. Now they're finally agreeing that we are at the 4th level, which is the greater numbers of transmission, which they call community transmission. If one hears Maduro or Delcy Rodriguez lately, they're talking about cases and they say these are community transmissions. This means, again, that blocking the possibilities of propagation is now really difficult, and that they're talking about states where also by being close to the borders and then people trying to still move between Venezuela and Colombia and Brazil, now they're forced to go through the back roads. This is posing a real problem. So unfortunately, in our response, we have been prevented now from continuing on with our program. There are many difficulties on the ground: lack of gasoline, arbitrariness by police forces and the military in regards to who goes from where to where, blockages among and between municipalities and states. This is posing huge problems for people. So I'd leave it at that, and Michael, but I think it sets at least the grounds for why we at civil society are calling for an urgent humanitarian agreement that puts people at the center, people's lives, and prioritizes it, and everything else should be second place. Thank you, Michael.
Thank you, Feliciano. That's a wonderful, I think, very comprehensive overview of the situation, and we will definitely come back to this prospect of a humanitarian agreement around COVID response. Daniella, Liendo, I'd like to turn to you. Feliciano gave us, I think, an excellent kind of macro view of the situation, which is very sobering. If I could ask you maybe for kind of a micro view, being there in Caracas, there have been measures taken by the Maduro regime to try to mitigate the spread of coronavirus. what do things look like from where you're sitting? Is it your sense that the mitigation strategy is working? And what is your what's your sense of the situation?
Yes, hello, Michael, and thank you very much for the space today, and more together with two people who work for our country, as well as Miguel and Feliciano. Well, let me tell you, Maduro, since Tuesday, March 17, decreed total quarantine in all the states of the country, and having confirmed the same day of his announcement, 33 cases. For half an idea, Colombia announced the first case, and a week later, our borders were closed. Currently, the mandatory use of face masks, gloves, and the restriction on circulation has been decreed from 12 noon. And here I want to emphasize the mask in several aspects. Since they are more demanded, the reason for their use has not been explained at any time, which means that in the first place, people use any piece of clothes to cover themselves, which is not proven to protect, but quite the opposite. And it also gives them a certain level of security and feeling of protection, before which they focus attention on the preventive measures they should have. And of course, this measure has made these resources much more scarce in the country and less available to help professionals than if they need them to work, even if they had the possibility of acquiring them through their means. It is unlikely that find without making a really, really big effort. Another measure taken was the provision of sentinel, or how can I say, strategic health centers, which unfortunately seem to have been chosen according to political convenience and not according to their capacity for real care. That definitely reduces the response capacity that our health system may have, since the few resources that could be allocated are not going to the hospitals that have the greatest capacity in each city. We see, for example, CDI or ambulatories, which are part of a parallel health system called Barrio Adentro, as a sentinel or strategic centers when they are outpatients, as opposite to type 3 or type 4 hospitals that are helpful with more staff capacity to assist the people. And for finish with your questions, on the other hand, at these small centers, they are testing people with the fast test that we already know is not giving us a certain results, because only works if the person has already 7 or more days with the active infection. These actions hardly contribute to create a false state of security or well-being in the people. Of course, this also concerns us as health professionals, in addition to knowing our responsibility and what we are facing as a global line of defense, and in our country, the first line of defense.
Terrific, Daniela. Thank you. Thanks for that. Really, I think brings to life the urgency of the situation that Venezuela is facing. Miguel, let me come back to you on the issue of humanitarian assistance, which you mentioned in your opening remarks. You are one of the many hats you wear is as the Commissioner for Humanitarian Assistance of the Guaidó government. And I guess I want to ask you two questions. The first is, we hear a lot of different things about how much humanitarian assistance is actually getting into Venezuela at present. We know the UN has been able to ramp up some capacity there, that some of the big international NGOs are able now to access the country, others are not. So what's the state of play in terms of actual humanitarian assistance today in Venezuela? And then the second question is, you were able in the last couple of weeks to help mobilize $20 million on behalf of the interim government for humanitarian assistance, which was then channeled through some of these groups that have access in the country. Can you tell us sort of what that looked like, how you did it, where the money came from, and whether that approach is replicable and scalable? Is it something that could be a mechanism for getting much larger quantities of aid into Venezuela under the current circumstances?
Yeah, thank you, Michael. I think we have to always make a separation between the level of assistance or the level of funding we are mobilizing or we are able to catch in the humanitarian response in Venezuela and the level of the existence of humanitarian space inside of Venezuela. And I make this difference because the UN system, the agencies, the Red Cross family, and NGOs are working inside of the country, and they reach in the past 2019 near 2 million people receiving assistance for humanitarian efforts inside of the country, according to the UN numbers and the final reports of 2019. But when you see the level of assistance you are delivering versus the level of needs, you see a huge gap. The need in the HRP 2019 was almost 8 million people, and the level of people or the amount of people you were able to assist was near 2 million. And I think also you can see the same in the funding. In 2019, the HRP was able to find $180 million for the internal response and almost 50% of the appeal for the refugee response outside of the country. But that level of money, that seems like a lot of money, is not enough to scale up in capacities and to bring a real humanitarian space. I think right now, PAHO and the organizations with WASH program, with water sanitation programs, have a huge task inside of the country. And in the level of this emergency, it's important to everyone who hears us that COVID-19 in Venezuela have a different challenge, because we are not only fighting with social distancing, with quarantines, with everyone remaining in house. We don't have water. We don't have soap. We don't have gasoline for the people to move around. We don't have electricity. In the last poll we made in the hospitals, almost 80% of the hospital was having a shortage of soap and the things they need for the minimum assistance. So I think we have important step forwards towards build a real humanitarian response in the country. I think that the response inside of the system is an important response. Without any doubt, we need more humanitarian diplomacy. And I think that's a challenge for the system. The ones running the humanitarian country team for the UN needs to make a little bit more of humanitarian diplomacy to open more space. And I relate this to your second question. We are, from the interim government, we're making a big effort in coordination with Treasury, with OFAC, and also in coordination with all the members of the National Assembly to mobilize funds to these international organizations, agencies, and the UN system. And for us, it's a real clear decision, Michael, that we don't have the territorial control. We are not the ones who have the control of the hospitals or give the access to the airports and the ports, but there's something that we can do. We can mobilize international community solidarity to Venezuela, and we can try to build a precedent of using these assets that have been protected from corruption and from the bad maneuvers the regime was doing with the Venezuelans' money, to make that money able to the humanitarian response. And we're trying to take a small step forward, but a step to build a precedent and to mobilize money from frozen accounts, from money recovered from the corruption or protected from the corruption, directly to the UN system and the family of organizations who can make humanitarian response in the country without political interference, without trying to build different priorities, without trying to have control of where's that going on with political purpose, respecting the humanitarian principles. But most of all, Michael, this effort aims to scale up in the future. The level of need Venezuela is going to have in the next 8 weeks. And I say this, I don't want to be an apocalyptical speaker, but there's no reason to doubt that in Venezuela in the next 8 weeks, we are going to have 3 things at the same time: COVID-19, shortage of food, and shortage of gasoline. And these 3 things, when you add it to the humanitarian emergency we had before, with 1/3 of the population in food insecurity or not being able to access to what they need, we're going to need a lot of money and to mobilize a lot of funds. And we're trying to build this effort from the interim government through the UN system and the organizations. And right now we're in the middle of the landing of this. I don't want to give too much details of the organizations of how are we doing this, because it's a fragile floor, the one we are stepping in right now, but we're trying to do this in the best way we can. And as you said in your question, this is a first step forward. It's a small one, but we're doing this aiming to scale up in the future, and also to do this without interference of the regime. Only to summarize, if we are able to mobilize funds and the humanitarian response, humanitarian space actually exists and it's built inside of the country, the only thing all of this operation needs is access. And access right now is closely related to political will. The humanitarian situation should not be taken as hostage of a political fight, because the politicians and this office is to save life. It's not to use the life as a collateral damage for a political purpose. Thank you, Michael.
Thank you, Miguel. It was Miguel Pizarro, Deputy Miguel Pizarro. Let me turn, I think that's a perfect place to pick up the conversation with Feliciano Reyna on this issue, Feliciano, of a humanitarian pact or agreement that doesn't necessarily get at the broader political impasse in Venezuela, but that tries to open up access and facilitate some of a greater humanitarian response from the international community in Venezuela. Talk us through, Feliciano, why you think that's so necessary, what it might look like, and to what extent it does or does not overlap with the vision that Deputy Pizarro just put forward.
Thank you, Michael. I have been, for the past 2 weeks, publicly stating that there's no way to respond to what is coming towards us, and very quickly. And I think Miguel mentioned 8 weeks. Hopefully we have that time. I tend to be even less optimistic, quote unquote. I believe it may be sooner. We're seeing the situation in Ecuador, and I've been following closely the response in Spain and really get afraid for what may happen to the Venezuelan population. But it is true also what Miguel was saying in regards to access on the ground. If one wants to prepare a response of the dimensions that are needed in Venezuela, given the previous damages caused to, all over the place. Unfortunately, again, what one sees, there is control of the territory by Maduro, by his government, by the military. They do have the possibilities of opening up that space or not. There are steps that should be taken immediately. For example, allowing the World Food Program in and in full cooperation, but really opening that coming in of the agency with the logistical capacity to perhaps even help overcome the problems with lack of gasoline and so on. But that would require, again, cooperation by the military and other law enforcement agencies, and in a context in which even UN recognizes the problem with paramilitary groups and local gangs and so on. But this is imperative. This is urgent. I've seen, say the framework or the proposals in Venezuela, the Jose Maria Vargas plan presented by the technical group working with Guaidó. But everything that one sees there, in order to be implemented, or all the efforts that Miguel Pizarro may be making that are, again, very hard and moving around and calling for support, and as well helping that Venezuela does not become a protracted humanitarian crisis. All of those efforts, in order to be implemented with the speed that is necessary, require this kind of agreement, between those who control the terrain and those who are mobilizing aid from abroad, that doesn't take out the possibilities of at least setting the stage for some political agreements, and one that we recognize in terms, for example, of a flexible, conditioned lifting of some sanctions, not individual. Would call again for the full recognition of the National Assembly with its powers to approve, for example, credits and support from abroad. But it is very urgent. I mean, what I don't see, and again, think about the framework and other proposals, is that they all require not weeks, they require months. They need a lot of talks, and unfortunately, I think we will be seeing scenes like starting to show in Ecuador, where people just drop in the streets. We do not have the conditions to face COVID-19 if it takes the numbers that we've seen in other places. We do not have the capacity in hospitals. We do not have the capacity to provide food and other livelihoods. So I hope something of this kind can be brokered again in a matter of days and not even weeks, because we do not have the time, I believe.
Thank you, Feliciano. Certainly, we want to ask Miguel Pizarro whether he sees that as a possibility and get the interim government's perspective. But before that, I want to turn back to Daniella Liendo. Daniella, let me ask you about the organization that you help lead, Primeros Auxilios, which does work really on the front lines, providing medical treatment in the midst of social convulsion in the country. What's the perspective from your organization and more broadly from civil society organizations in Venezuela? Are they in a position to support the response of the public health system, which, as we've heard, is extremely fragile and likely to be overwhelmed in the near future if something urgent doesn't happen?
Yeah, well, the role of the civil society at this time, I think, really becomes enormous. Perhaps NGOs will be expected to have material resources, but unfortunately, it is something that goes beyond individual management and should be a plan governed by those responsible for public health. Us as civil society, we have focused our efforts on providing verified information about the pandemic that is sorely needed, seeking to expand information channels in the middle of the country with one of the poorest internet service in the world. Here I have to confess that I'm really surprised that this call can happen today with you, with our internet. Other fact in Venezuela is that it's a country where communications are really censored. All of this I mentioned is part of our work, in addition to collaborating in detecting the real situation in each hospital so that the efforts of the National Assembly and organizations are as close to reality as possible. We're looking for all ways for the Venezuelan to stay home, knowing why he doesn't have to go to the hospital without complications, and more in our already collapsed system. Well, we have even ventured into telemedicine, for example, in order to bring patients with symptoms who do not meet the conditions to go to the hospital, to the doctors who volunteer every day from all the universities in the country. I have to say that I'm really proud of this initiative because it's growing every day, and we can connect doctors with patients every day more and more.
Terrific. Thank you, Daniella. Let me just turn back to Miguel Pizarro to close out the conversation. Then I want to turn to some of the questions that we've been receiving. So thank you for those who have sent those in. And Miguel, the question is on this idea of a humanitarian agreement around COVID-19 response. I think you've made a very compelling case that ultimately, for democratic reasons, but as well as humanitarian reasons, a transition is necessary and overdue in Venezuela. I suspect few people on this call would disagree with that, but we've also heard about just the sheer emergency and urgency, and the fact that Venezuela really is staring down the barrel of COVID-19 and doesn't have any time to spare. So, from your perspective, is there scope? Are there discussions regarding the possibility of a pact between the Maduro and Guaidó factions around COVID-19 response? How do you assess the possibility of that occurring? Is it something that you're even open to or considering?
Our aim is to save the life of the Venezuelan, Michael. And for that purpose, we, not only in public, not only in private, in any way possible, we're delivering the same message. We put in order all the technicians, all the health personnel, the commission of experts, the level of access we have to international community, and the possibility to mobilize international solidarity for this purpose, for giving a broader an answer to COVID-19 according to the internal needs. And I think there's two different tracks that should not be never overlap one over the other. It's a political track to build a transition and to find a political way out to the huge nightmare we're living right now. And there's another track that is the humanitarian track, that we're not waiting until the transition to start doing things. And that's why we took the first movement and we start to move this $20 million and trying to give them to the UN system and the humanitarian system. We're not waiting for the transition to ask for the international community to mobilize funds for the humanitarian response in the country. And we are not waiting for a political negotiations about election or about the rebuilding of the institutions to ask for the opening of a real humanitarian space. And I say this because also sometimes in the political analysis, we're trying to summarize everything to a picture. And there's a lot of people who think that the only solution for the internal situation is a picture or a meeting between President Guaidó and Maduro. And we think that's not the path to follow, because this is not a matter of political interaction or political legitimacy of the regime or the interim government. This is a matter of political will. And understanding that this is a matter of political will, we're doing everything we can to do what it's in our hands to do. And we understand that a lot of these things can happen without the regime acceptance of opening the space. But I think in that place is where we have to aim all the pressure in supporting the creation of a real humanitarian space in the country without any kind of political interference, not political interference from the regime, neither from us, with any kind of prosecution or harassment against humanitarian actors, but also with a clear narrative that the Venezuelans and the suffering of the Venezuelans should come on first. And for us, it's not a matter of political truce or political pact to save life. We're doing what we can, and what we're encouraging the international community, the humanitarian system, and everyone who is really worried about it in the same way we're here in this call, is to make all the pressure to build a neutral, real humanitarian response in the country. But being neutral about the humanitarian reality, being neutral about how the regime is trying to manage the humanitarian situation, at the end is supporting the regime. We have to press a real humanitarian space. And the final result of what some people believe is a political pact is mobilize funds, trying to mobilize international solidarity, and to use assets that right now are under protection of corruption to being able to be used for the internal response. And that we are more than able to do it. We have the political will to do it, and we are doing it. And what we need is all the pressure possible to the regime, to make the regime understand that the people is going to die because of their lives, but also because taking the humanitarian situation not seriously for political purpose is totally a nonsense for the country and for the Venezuelans.
Thank you, Miguel. This is it's been a great conversation so far. I want to now turn to a number of the questions that we've received from folks who are listening in. There's a lot of good questions. I won't get to all of them, but we'll try to hit a few. One question directed at Feliciano, Reyna, and Miguel Pizarro has to do specifically with the import of gasoline and U.S. measures that U.S. sanctions that restrict that. But maybe we can broaden the aperture just to ask about sectoral sanctions and the impact they are having. There have been calls from Democratic senators, an editorial in the Financial Times this week, suggesting that U.S. sanctions on countries like Iran and Venezuela should be relaxed in this time of COVID-19. Feliciano, maybe you can give us your thoughts first, and then we'll turn to Miguel.
Thanks, Michael. Yes, we have called for flexibility with sectoral sanctions, and we've said even conditioned flexibilities, but of immediate implementation, and that comes through again the approval of any sort of credit line or imports of goods by the National Assembly, and recognition of its legitimacy and Guaidó's presidency, but as well, again, recognizing that implementation depends on the Maduro government to allow for access. But again, if this takes a while, and I agree with what Miguel said in terms of we don't need the two sitting down and showing a picture of agreement. It's basically allowing for an interinstitutional integrated coordinating body that that has expertise in implementing this sort of widespread humanitarian response. But for example, in order to bring in, I believe, gasoline and having logistical capacity and vehicles and helicopters to reach indigenous communities in the south, and because they cannot be reached nowadays, private flights are forbidden, which is absolutely awful because it also impacts those affected by malaria. But again, it would be possible to bring in gasoline and capacities, logistical capacities for distribution of food, of medicines, of treatments, that stuff that we're doing as an organizations immediately. And then I also believe that having some sort of deals with these resources that have been mobilized and can be mobilized further can also be moved through international agencies that are not affected by the sanctions, that have the possibilities of coming in. But some sort of flexibilization probably would be needed to have a more expanded response in the dimension that is needed.
Thank you, Feliciano. Miguel Pizarro, same question to you about potential sanctions relief.
Yeah, I think first we have to make a clear difference between the Venezuelan case and North Korea, Iran, or other cases. We don't have a full embargo. The sanctions, the regime sanction against the regime, and the sanctions that are being implemented by Europeans and USA have, both of them, clear exceptions for humanitarian operations. And as we said before, we are more than able to work further in the details of all the exceptions needed for humanitarian operations, but we are not in any way in favor of easing the sanctions against the regime, because the problem in Venezuela is not a matter of access to money. In the moment we had the oil barrel in the highest price, in the moment we have the best conditions, in the moment we should be doing savings for these kind of moments we're living right now, the regime spend all the money of the Venezuelans in corruption, in trafficking, in illegal activities. And it's totally absurd that we think that the same guys in the same regime with the same amount of power inside are going to behave different only because right now we have an outbreak. They didn't care before about the life of the Venezuelan, and we know for sure that they don't care right now. So for us, I make the first difference between North Korea and Iran, because we work a lot and we make an important effort to have the exemptions for the humanitarian purpose in all the sanctions and in all the decisions are be taken for the international community. And with that on side, we also have two other options that we are saying to the international community and also to everyone inside of the country, even for the regime, to mobilize funds, to have access to international multilateral banking. We need a different approach from the political arena. And that's why we link this with the emergency government. There's no way that Maduro can have a credit from IMF or World Bank or Nicolas Maduro access to the multilateral funding. But a different political scenario should open those doors with any problem. But what we do, if we don't have that right now, we only sit and wait until the catastrophe scenario arrive. I think that's not the option. And that's why we're trying to set this precedent of mobilizing funds directly to international organizations. That's why we're trying to mobilize all the international solidarity directly to these international and national organizations. And we are making all the effort to open a real humanitarian space to mobilize all the funds. About the sanctions, and only to be real clear about this, all the humanitarian exceptions made it for us are really important, and we can work further in going deep in those kind of details and going deep in those operations, but we are not in any way in favor of easing the sanctions against the regime. The sanctions are against the regime, it's not against the country.
Thank you, Miguel. Let me turn to another question, and I'll pose this initially to Daniella. The question is about the impact of closing the borders in Venezuela. We know that some 5 million people have left the country, essentially voting with their feet. That is restricted, at least in a formal sense now, with the borders being closed, although we know that the border with Colombia in particular is quite porous. But the question has to do with kind of the social impacts of this, Daniela. And the question is, if the population has nowhere to go, if it can no longer vote with its feet to leave Venezuela, does that translate into increased pressure, increased kind of social mobilization for political change in the country? What is your sense?
Yeah, of course, I think this increased the depression out in the streets, but I have to remember something that you said in the introduction, and it is that basically this is an emergency over the humanitarian emergency that we were already experiencing in Venezuela. Without the virus in the country, there was an imminent collapse of the health system. For example, patients without treatment, health professionals without or with starvation wages, and hospitals without basic conditions. This is not something about the virus right now, and this is not something happening since 2 or 3 weeks until today. In other words, before the pandemic, a patient with a serious injury, for example, or a woman who was going to give birth, will walk through 2 hospitals lucky before being admitted. This is increasing every day in all the country, and more in other states that are not Caracas, for example. This, I repeat, and I'm really interested in you to understand that it's not a matter of the coronavirus. It is an emergency that we have been exposing to the world for several years, and that if we fail to understand that health doesn't really discriminate if you are from the right or the left, and we sit down to solve this in scientifics, health, there will be a greater misfortune, as you say. And I'm going to be honest with you, from the bottom of my heart, this is really, really hard for me to say today, and more in this situation. For finish, I'm trying to answer you in concrete figures. 62% of our hospitals don't have water, for example, or the service is intermittent once a week. As Miguel said in another answer, 60% don't have soap to wash their hands, for example. I think I don't want to bore you with my answer, but I think it's really important to understand that this is not a consequence of a virus, and we still living in this humanitarian emergency for years until today.
Thank you, Daniela. I think that's an incredibly vivid and sobering image with which to end the conversation. So I'm going to respect everybody's time and call an end to the conversation here. I just want to thank again Feliciano, Reyna, Daniella, Liendo, and Deputy Miguel Pizarro for joining us, for sharing their expertise, but also sharing some insight into the important work that they're doing from different walks of life to try to mobilize an adequate response to this very dangerous situation for Venezuela and for the broader region. So again, thank you to our panelists, and thank you all for joining us. We'll be doing more of these events focused on COVID-19 in the region. So please stay tuned for that. Thanks again for joining us.
Thank you, Michael, and thank you, everyone. Bye-bye.
Thank you so much for the opportunity today.
Thank you, Michael, and the dialogue for your support always. Thank you.
Thank you all.